Let's talk about something that's really important for your pumping journey. If you pump 8 times a day or just once every now and then, Flange Fit is going to be something that's going to increase your comfort, and it's also going to be helpful for your milk output. On the table in front of me are a few different flange types. There are parts where they are fully separated or where they're all a part of the entire head, but what you'll see overall is they're all going to have a different measurement, and they're going to be measured in millimeters. That millimeter measurement actually has nothing to do with the outside of this flange. It's all about the entrance of the tunnel, and that's because Flange Fit is not about breast size. It is about nipple size. When you get your breast pump, it'll probably have in the kit either one size of breast shield or more, even some inserts. So let's talk about what those different sizes mean, if the ones in the kit will work for you, or how to find another size that will be the best fit. So when it comes to measuring for Flange Fit, there are a few different options and ways to think about it. On the table in front of me, I have 2 different sizing guides from 2 manufacturers that we work with. And they have holes there that you can measure with, and they also have a little ruler on the edge. So when we think about measuring, these holes are typically what we think of, and we line it up to our body and see which one fits best. But what exactly does that mean, and how do we define that? So I really like when there's actually a measurement tool on the edge to measure, like with a tape measure or anything you might have at home that has indicators on there. Something to note is that 1 centimeter is 10 millimeters because all of your flanges are measured in millimeters. The general process of measuring for Flange Fit starts by gently stimulating your nipple, so you don't want it to be fully at rest. You're then going to take your measurement tool and measure the diameter of your nipple. So we recommend doing that in 2 ways. Horizontally, so from left to right, and then also vertically up and down. So the reason why we recommend taking those 2 measurements is because nobody's nipple is a perfect circle. And so taking those 2 measurements will give you either the same exact millimeter, or it might be 1 or 2 off. And what you're going to do is take the larger of those 2 measurements. When you're doing the measurement, a lot of people will say to measure at the base of the nipple, but that's not always the easiest thing to find because oftentimes there's not a difference in color between your nipple and your areola around it, or sometimes the tissue just may not be easy to differentiate the nipple from the areola. So we actually recommend measuring the tip of the nipple instead of the base, just so it's easier to locate, and it may be even easier to get that measurement there because you can see the tool. Okay, so you measured, you got the 2 measurements, horizontal and vertical, you took the larger of those 2 measurements, and now what do you do with that? Well, first, not every side is going to be the same, so make sure you measure independently the left and the right side of your body. Then you're going to take those measurements and you want to think about what that actually means for the flange that you're using. So recommendations currently state to take whatever that measurement is, whether it's 15 millimeters as an example, and try sizes of breast shields from 1 less up to about 2 or 3 millimeters more. Now when I give that range, it's going to sound really confusing, but the main purpose is your comfort. And so that's why there is a range. Don't base it on a set number and say, well, we have to add 2 millimeters and that's what my size is, because how you measure is just the first part of it. Your comfort and your output is what's most important. So if you measure at 15 millimeters, you can try flanges from around 14 and a little bit higher than that 15. You also want to note that when your nipple enters the tunnel, it's actually okay if the nipple touches the sides of this tunnel in here. But what you want to make sure is that it's gliding along. There's no friction or rubbing or anything causing any discomfort there, but it's able to move within there freely. Think about it as if somebody is nursing a baby, the nipple will enter and touch along the sides and tongue and palate of baby's mouth, but there's lubrication in there because the baby has saliva. So you're able to touch the sides of there, and you may want to use some sort of lubricant while pumping, like coconut oil or olive oil, something that's food grade safe that you feel comfortable using on your body. The other thing to think about is flanges are not all hard plastic. Some of them are silicone inserts or silicone cushions. You may notice that your nipple reacts differently or will fit differently when there is a silicone insert or a silicone cushion used. So keep that in mind when you're looking at the comfort, the sprays of milk, and things to think about if it's the right fit for you, if you are using anything that is silicone or different from a standard hard flange. Okay, so you got your flange size. You're good to go, right? Yes, But it's also important to note that nipple size can change over time. It's totally normal and that's okay. So every now and then, check in with your body, see if you're still comfortable using the same size. If you notice any difference in your output, or if you notice a difference in the feel, those are good indicators to try something else. Another common question that we get is when to measure. So you can measure prenatally. We usually recommend towards the end of your pregnancy, and then postpartum, of course. What are some signs you're using the wrong flange for your body? Discomfort, pain, any of that is a sign to check your flange fit. But also, if you have a delayed letdown, your milk isn't flowing within at least the first minute of pumping, that milk release should happen fairly quickly with the correct flange fit. And lastly, you want to think about the milk flow. How is the milk flowing when you are actually pumping and collecting? If it's not flowing significantly, or if you're not collecting much milk given the time frame when you're pumping, you want to think about maybe this isn't the right size for me. As I mentioned before, you may measure one side at a different measurement than the other, and so you may actually need a different size flange per side. If you have any questions about this, because it can be really overwhelming, you can measure at home, but you can always reach out to an IBCLC or a lactation professional in your area and see if they can help you measure.